Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 085. During an outdoor school event in hot weather, a 10-year-old girl lost her consciousness. Body temperature 36.7 degrees C. Objectively, her skin is pale and cold to touch, her pupils are dilated. Blood pressure 90/50ths of a millimeter Hg. Heart rate 58 per minute. What pathology occurred in this case? A. B. Sunstroke. C. Syncope. D. Sympathicotonic collapse. E. Paralytic collapse. Syncope, fainting, passing out, is a sudden short-term loss of consciousness caused by a temporary drop in the amount of blood that flows to the brain, sudden drop in blood pressure, on the background of autonomic paroxysm, a sudden physical response including laughter, rage, or sneezing. Sympathicotonic collapse is usually characterized by short-term and characterized by agitation of the child, increased muscle tone, pale skin, cold extremities, tachycardia, normal or slightly elevated blood pressure, and decreased diuresis. Vagotonic collapse is accompanied by inhibition of the child, hypo or adynamia, decreased muscle tone, pronounced pallor and marbling of the skin, acrocyanosis, a sharp drop in blood pressure, a pulse of weak filling and tension, tachy or bradycardia, shallow, noisy breathing. Paralytic collapse is characterized by loss of consciousness, bluish-purple spots on the skin, falling blood pressure to critical numbers, decreased central venous pressure, filamentous pulse. Bradycardia, decreased cardiac output, bradypnea, Cheyne-Stokes respiration, oliguria. Paralysis is the loss of the ability to move some or all of the body. Heatstroke, sunstroke, is characterized by an rapid increase in body temperature, possibly to 40 or higher within 10 to 15 minutes, due to the inability to cool it down by sweating mechanism, resulting in overheating of the body. It is caused by prolonged exposure to the sun, thermal radiation, often leading to thermal exhaustion. It can cause permanent disability or death if the person does not receive emergency treatment. Symptoms: very high body temperature, 40 or higher, hot, dry skin or profuse sweating, confusion, altered mental status, slurred speech, loss of consciousness, coma, seizures. The answer is C. Syncope.